So you feel like you've tried every preventative migraine medication and nothing works? It can feel like that. But let's take a step back and look at the math because the numbers are shocking. First, I'm Brooke, and I'm a Neura Health nurse practitioner specializing in migraine and headache disorders. So let's get to this. So there are conservatively at least 25 plus preventative migraine medications available. If you've tried all 25 for the proper trial duration, that would take over 6 years. But that doesn't account for polytherapies or combining medications. If you also tried every two medication combination, it would take 75 years. And if you tried triple or quadruple combinations, over 3,800 years. So while it absolutely can feel like you've tried everything, let me reassure you that you haven't run out of options. It's more about finding the right specialist to help you find the right treatment plan, and that can take time and a lot of patience because there's no one size fits all migraine treatment plan. If you haven't found a solution yet, you can consider things like this. Seeing a headache specialist who is an MD or a DO, typically a neurologist, who specializes in migraine and headache disorders. There are also specialized nurse practitioners like myself or physician assistants who only treat migraine and headache disorders. Our entire focus and passion are migraine and headache disorders, and it's our job to know about every possible treatment option, including many a general neurologist may not know of. There are also polytherapies or finding your right mix. Maybe it's combining a CGRP monoclonal antibody inhibitor with Botox or even adding a third medication like topiramate. We don't want to forget about non-oral medication treatments like Botox infusions, neuromodulation devices, nerve blocks, and even biofeedback as additional evidence-based methods to manage your condition. So remember, migraine treatment isn't always a straight path. Things change. There can be a lot of trial and error, but just because something hasn't worked yet doesn't mean nothing ever will. So don't lose hope. Know there are plenty of other options available and so many more on the horizon. And if you need a specialist to help you along the way, you can always find us at Neura Health.